Good afternoon. I'm Melissa Ridgen with your APTN News Weekend. An investigation into how an Ojibway woman died while in care at an Alberta hospital over the holiday is underway. Family of the woman, a member of the Sandy Bay First Nation, questioned her treatment while in hospital. Tamara Pimentel has a report on what happened and a warning: recordings of the incident may be disturbing.
In the hours leading up to her death, 40-year-old Lillian Ashley lays in a hospital bed with difficulty breathing. Her husband, Corey Ashley, is beside her and took this cell phone video after he says he begged hospital staff in Hanna, Alberta to give her oxygen.
She wanted to live. She deserves to be alive. And this is what I have of my wife.
Now, as he picks up his wife's ashes 200 kilometers away in Calgary, Corey questions her treatment at the Hanna Hospital and why Lillian, a well-respected Ojibway woman, died December 26, 2020, while in care.
Everybody that knew her was glad they knew her because she touched them some way, somehow. 2015. We lived in Kamloops, started making food, collecting clothes, and we were bringing them to the homeless. My wife gave to everybody.
It was Christmas morning in their home in Hanna when Corey realized something was wrong.
I could see my wife's face was just beet red. She had sweat dripping down her face. I walked up, I put my hand on her head with the back, and she was burning up. And what's wrong? She goes, I can't breathe. She goes, it hurts, something's wrong. And I knew right then there was something. I dialed 911 instantly.
According to a medical record that Corey provided, when paramedics arrived, Lillian was sweating heavily, was pale, and her right lung sounded decreased. She was then taken to emergency.
And that's where my wife is on a bed. No oxygen, no nothing on her. She's just laying there trying to breathe. I went right up to my wife and I put my arm on her. Are you okay? She goes, I can't breathe. I need help breathing. I can't breathe. I need air. And she was shaking. She was scared. And now she was cold instead of hot.
After an electrocardiogram, an X-ray of her lungs, and COVID swab, the X-ray came back clear and COVID had been ruled out. Corey says he then requested many times for his wife to be given oxygen, and that she had been in hospital for almost 2 hours without oxygen. Frustrated, he began to record. In this video, nurses can be heard telling Corey that the hospital computers are down and test results are needed before any further treatment is given, as well as comments about Lillian's use of methadone, a pain medication prescribed by her family doctor to treat abdominal pain.
She's admitted to taking too much methadone, and she hasn't had any since yesterday morning.
Corey says his wife did take too much methadone. She finished her prescription 3 days earlier than she was supposed to, 1 day before arriving here in the emergency room.
That's not why she's here. She can't breathe.
The medical record shows there is no mention of oxygen, but under the diagnosis section, methadone withdrawal and cardiorespiratory arrest are written. APTN spoke with a doctor who was unable to comment about this specific situation, but was able to give us some general background information. The doctor said when a patient arrives in an emergency room with difficulty breathing, oxygen is often provided. The doctor also said that the use of painkillers like methadone is not a reason to withhold oxygen.
All she could say was, I'm really scared, and it was so faint. I knew she wasn't doing well, and they wouldn't believe me.
After confrontation with hospital security, RCMP were called and Corey was asked to leave. The medical records show that Lillian had then been giving breathing exercises. While in the hospital parking lot, Corey continued recording. An RCMP officer is heard relaying information from Lillian's doctor.
So the doctor tell me that they've checked all of her vitals and everything's looking pretty normal, but they are going to keep her for observation for the night, okay?
It was later that night when the doctor called.
And she goes, is this Corey Ashley? I went, yes. She goes, Corey, you have to get here. Your wife stopped breathing. I said, is she okay? And she says, no, she's not.
He says when he arrived back at the hospital, He saw Lillian undergoing chest compressions.
Because I looked and my wife's body was dead. There was nothing there. I could see it. I heard a nurse say she's had no pulse for 45 minutes since we found her. I put my hand under the blanket as I'm calling out her name, and I put my hand on my wife's leg, and it was cold.
In a phone call, a medical examiner investigator told Corey that Lillian died with wet lung, a condition resulting in the lung's inability to receive enough oxygen. The cause of death is unknown, and it could take up to 6 to 12 months to determine. An email from Alberta Health Services states, "We are unable to discuss specific details of this case due to patient confidentiality and privacy." It said an investigation into the incident is being done. Meanwhile, Corey says he is seeking justice for his wife and has filed a complaint to the Alberta College of Physicians and Surgeons.
My wife, just like every other person on this earth, has the right to breathe.
Tamara Pimentel, APTN National News, Calgary.
2 days of federally led talks on addressing systemic racism in healthcare have just wrapped up. They follow up on an urgent meeting convened last year following the death of Joyce Echaquan in a Quebec hospital. A reporter in Ottawa, Brett Forrester, shared the latest with Dennis Ward this week.
It's no secret Indigenous people face racism in healthcare. The racist taunts hurled at Joyce Echaquan before she died made that clear. But the goal of these talks was to find solutions. Coming out of the meetings, Ottawa plans to kickstart engagement process on developing new Indigenous health legislation. The Prime Minister earmarked $15 million for this process in his 2020 throne speech. The federal government promises to increase support for Indigenous-led health organizations and development of new governance models that increase control over federally funded services. They're pledging $4 million to combat discrimination in medical schools and $2 million for the Atikamekw Nation to advocate for Joyce's principle. Indigenous leaders, provinces, territories, and healthcare professionals all received invites to today's talks, and 4 federal cabinet ministers also attended. They issued a detailed statement condemning systemic racism and its quote-unquote catastrophic effects. They say stamping it out will require collaboration and called on several other parties, the provinces in particular, to do their fair share. The plan is for a third round of meetings to take place in spring of this year. This is a developing story, and we're continuing to track reaction. Back to you in Winnipeg.
A Vancouver man continues to recover in hospital after being brutally assaulted in a tent city last year. Tina House has this story on his road to recovery and a warning some images may be upsetting to some viewers.
I do forgive the people that did this to me, I hope to find a better life and a better perspective at life and not to live in such a negative way.
25-year-old Carl Sinclair is still trying to heal and recover from a brutal assault that happened on September the 20th, 2020. But he says forgiveness is helping him move on. He says he was only in Tent City in Strathcona Park for about a week and drinking heavily when the horrific attack happened. Doctors have told him that a torch was used to inflict a few of his injuries.
This is the big scar right here from the torch. And he tried to burn my heart out, but I guess I was fighting, so it just went across instead with the torch.
He was left lying in a tent for about 12 hours before someone called 911. Sinclair doesn't remember the attack and woke up in hospital to discover that doctors had amputated his left leg up to his hip due to lost circulation as well as an infection that had set in.
The infection's gone right now, so I'm pretty happy about that.
He nearly lost his left arm too.
This is the big cut I have right here. Tendon damage. I had a torch right here. A big hole right here. It's healing pretty well. So they had to take a bunch of muscle out, muscle memory, because I slept on my hand. So a bunch of dead muscles are in my hand.
Life hasn't been easy for Sinclair. He says since the age of 12 to 19, he was in 23 different foster homes, and he became addicted to alcohol and drugs. After the assault, his mother didn't hear from him for a few days and called around and found out he was in the hospital.
Well, when I walked in, I was in shock, I think. I broke down and I went over to him right away. He was waking up every few minutes traumatized. He kept trying to fight somebody and he was kicking, and that was really hard for me and heartbreaking to watch that.
So far, investigators are still looking for who was involved in the vicious attack. His mother, who currently lives in Lytton, BC, is trying to find a place with wheelchair accessibility for her and Carl to move into so she can take care of him. But so far, they have nowhere to go after he's released from hospital on February the 10th.
My hopes and dreams are to get connected with my culture, be more spiritual, mentally, physically. I have a second chance at life, and you know, I don't want to ruin that second chance of life.
A GoFundMe has been set up to help Carl Sinclair and his family. If you have any information into the brutal attack on Carl Sinclair here in Strathcona Park, you're asked to call the local police. Tina House, APTN National News, Vancouver.
The week kicked off with controversial Senator Lynn Beyak announcing she's leaving the Senate effective immediately. In a statement put out on Monday, she said it was her last day. Beyak landed in hot water when she'd said that good deeds also happened at residential schools. Her comments ignited controversy. Beyak also posted and refused to remove offensive letters on her website. That led to her suspension from the Senate in May 2019. Beyak stood by her comments that there was good as well as bad at the residential schools in her resignation statement this week, and said that her support of an 8-year term limit for senators is the reason why she resigned on her 8th anniversary. Time for a break, but when we come back, Vancouver millionaires who went through great pains to jump the queue to get a COVID vaccine in the Yukon, and what's in store for them for getting caught, that's still ahead. Welcome back. People who live at the White River First Nation in the Yukon are expressing outrage after a pair of wealthy Vancouverites traveled to their community to jump the line on COVID vaccinations. Here's Sarah Connors with that story.
Ronge and Ekaterina Baker flew from Vancouver to Whitehorse on Tuesday, January 19th. On Thursday, January 21st, they chartered a flight from Whitehorse to Beaver Creek, a small border community with a population of 93 people. When they arrived, they went straight to the mobile COVID-19 vaccination clinic.
It was almost this sense from the charter company that they thought that these people were helping with the vaccine clinic.
John Stryker is the minister in charge of the Yukon Civil Emergency Act.
What I'm told is that there was a couple which came into the clinic and said that they were working at the motel in Beaver Creek.
The Bakers were able to get vaccinated because the clinics accept out-of-territory health cards, as some residents don't have Yukon health cards.
One of them had an Ontario healthcare card and one had a British Columbia healthcare card, and they just presented themselves as local workers.
The pair later raised suspicions after asking for a drive back to the community's rarely used airport.
The mobile vaccine unit, the Togo team, they decided to call the motel just to ask about these two people. And the motel said they didn't know who they were.
The vaccine clinic alerted Civil Emergency Act officers who tracked them to the Whitehorse airport as they were preparing to leave the territory. They were both ticketed and charged for failing to self-isolate and for failing to follow their signed declaration. Their fines totaling $1,150 each. 55-year-old Rodney Baker was president and CEO of the Great Canadian Gaming Corporation, receiving a salary of over $10 million in 2019. He resigned on Sunday. 32-year-old Ekaterina Baker is a Russian-born aspiring actress. Now, members of White River First Nation are expressing outrage, not only because the Bakers got vaccinated, but because they also could have put community members at risk. Like White River citizen Bessie Chassays, who was at the clinic when the Bakers were there.
And I think I was just more upset too because my father was there and he's at high risk.
White River First Nation Chief Angela Dermott wrote in a press release yesterday, How dare these two privileged multimillionaires come into WRF in traditional territory and the small community of Beaver Creek, Yukon, and lie to medical professionals, putting our community at risk to jump the queue. Quanah Giuseppe Vandermeer is another member of the First Nation.
I'm pretty shook up about that. I don't know how they were able to just charter a flight in to an airport that's rarely ever used.
He says the millionaire couple's punishment isn't harsh enough.
No, I think it should be much larger than that, considering they put this whole community at risk.
Beaver Creek RCMP are investigating the incident. The Yukon government says it is looking into other ways to prove residents live in the territory besides health cards, so an incident like this doesn't happen again in the future. Sarah Connors, APTN National News, Whitehorse.
The Northwest Territories have been able to keep COVID-19 at bay, especially in the smaller communities. But as cases creep into Fort Liard, Northerners are quickly responding, getting their messages across in one of the most trusted mediums around. Charlotte Moritz-Jacobs brings you that story.
Hi, good afternoon. I'd like to welcome everybody to
the Saturday Request Show is a staple in households across Denendeh.
That, bringing the community together. For me, that's what it's all about. Making sure everybody kind of stays together, stays strong, and and I never get to hear myself, so it's a good thing.
Myra Conrad has been here for the better part of 20 years. Some things never change.
Hello.
Can you hear me?
Yeah, I could hear you.
Switch my song from last week. I don't even think I went on last week, or did I?
No, I haven't heard you in a few weeks.
CKLB Radio is an Indigenous station. So, as the 500-person Dene Métis community of Fort Liard deals with COVID-19, it only makes sense to do what they do best.
This campaign is about people across the territory offering support to family and friends in Fort Liard.
Messages come from near and far.
And we have Chief Norman Nicolaya.
And I want to say to the elders, Chief Hope, Mayor Danaron, and the good people in Fort Liard, that the Dene Nation stands with you all. And we ask that you continue to keep safe by following the COVID guidelines. The Dene values of sharing to help each other is so much needed now at this time.
On January 20th, Fort Liard reported 6 confirmed cases with 50 people in isolation after one case led to a community cluster. All residents are in good recovery, and the community is under a 14-day local containment order, prohibiting gatherings and closing schools and non-essential businesses. But Conrad says everyone who phones in understands the severity.
Everybody really wants to follow the guidelines, the COVID guidelines. One of the main things that I've gathered just listening is, everybody really has to stay like 6 feet apart, wash your hands, stay home, don't go out if you don't have to.
And for Conrad, the pandemic is personal.
I have family in the south. I have a half-brother that is struggling with COVID right now, and it's really hard because we can't be there as a family for him. I can't even go visit him, even if I wanted to, like I do really want to let him know I'm there for him, and I can't go, I can't travel out of the north.
While the ways Northerners support one another have changed,
I know Fort Liard, they love Jody Jones, so anything by Jody Jones.
NWTers will get through it together.
I should have called, okay.
Yeah, that's one of the good Dennis songs.
One tune at a time. Charlotte Moritz-Jacobs, APTN National News, Yellowknife.
Time for another break, but when we come back, a 9-year-old hockey star making a name for himself on TikTok in his backyard rink. Stay with us. A 9-year-old Algonquin boy in Quebec is making waves on social media for his moves on the ice, and that ice happens to be in his own backyard. Our Daryl Stranger has that story for us.
Washie Janot is making a name for himself in the hockey world thanks to his viral videos showcasing his hockey skills. The 9-year-old from Algonquins of Barrier Lake has been playing hockey since he was 4. Washie is unable to play or practice hockey due to the pandemic, so the family decided to build him and his brother a backyard rink where they could hone their skills.
hockey is a huge thing with us. We have weekend games, we have weekday practices. So for us to lose that and for the boys to lose it, we wanted to, we said we would make an outdoor rink. And we had tried the bid last year, but this year we wanted to make it bigger and better.
The rink is complete with miniature boards and lights so the kids can play almost any time. Washier's videos have garnered millions of views on social media, with the NHL even posting on their social media accounts. He says he loves everything about the rink and being on the ice.
Having a backyard rink is awesome. I love skating, I love doing slap shots, and I love doing trick shots. I hope all you other kids keep on skating.
The family is also working on incorporating Indigenous music into the videos as a way to showcase their heritage.
We were talking with my sister who is a singer for Black Bear. She sings the vocals for it as well, so we were trying to incorporate some of her music in there. We want to be able for Wash to be proud of who he is. So through these songs that they do sing, it makes them proud. For him, being First Nations and being recognized at this level, it was a huge deal for him.
Washier has just one reminder for all the other kids out there that are watching his videos.
These trick shots are fun, but guys, remember, the most important part about hockey is playing as a team. Miigwech.
Daryl Stranger, APTN National News, Winnipeg.
In other hockey news, legendary Toronto Maple Leaf captain George Armstrong died this week at age 90. Armstrong was one of the first Indigenous players to play in the NHL, and he was the first Indigenous player to score a goal in the league. Armstrong was nicknamed the Chief by the Stoney Reserve in Alberta during his visit in his early playing days. He played over 1,100 games for the Leafs and captained them for 12 years. He won 4 Stanley Cups and was ranked number 12 on the greatest 100 Leafs of all time. Armstrong was inducted into the Hockey Hall of Fame in 1975. His granddaughter Kaylee says George was proud to be one of the first Indigenous people to play in the NHL.
We're very proud of him, and he was so proud to be Indigenous and kind of be one of the first people of Indigenous descent to play in the NHL. And I think he's impacted so many people, and we're kind of the past few days have just been crazy. We're just realizing how many people just absolutely adored him, and it's been obviously tough, but it's been so nice to hear so many people tell us how awesome he was.
Well, that is your APTN News Weekend. We have lots more on our website too, aptnnews.ca. I'm Melissa Ridgen. Have a great night. See you back here next week.